Good evening, good evening, good evening, family and friends. Welcome to another edition of King Talk Tuesdays. I'm your host, Andy King, the show with real views, real news, and real talk. We cover all types of topics, including healthcare, education, spirituality, economics, and so much more. I look forward to you all joining me all throughout the week for more dynamic and inspiring conversations. King Talk Tuesdays airs every Tuesday live at 7 p.m. on Millennium TV News 24, as well as Facebook, Horizon Satellite, Apple TV, Amazon Prime, and so much more. We also air at 9 p.m. on Optimal Channel 70, as well as Fios 2136. You can tune into all of your local listings to check previous episodes of King Talk Tuesdays that are airing throughout the week. You know what I always say, right? People pay attention to people who participate. So tell a friend, tell a neighbor that King Talk Tuesdays is airing now at 7 p.m. here on King Talk Tuesdays. You'll also want to let people, if they know, if you want to send a thought or comment, you can email us at kingtalktuesdays@gmail.com. Again, our email address is kingtalktuesdays.com. So, there's a lot of things that have been happening in the world. But you know what I really want to know? Well, as the great Marvin Gaye would say, what's going on? What's going on? What's going on? What's going on? Well, we're going to talk a little about what's going on in the Boogie Down Bronx and what's happening throughout the city of New York. We just want to touch on three things, and we want to let you know the community board seasons are happening again across the city of New York. So if you're not a part of your community board, please find out what dates and times that your community board to be actively engaged in your neighborhood, to know what things are happening in your community, from housing to safety to just services that are being provided from the city of New York. We want to let you know that tomorrow, Thursday, the 25th of September, that Community Board 12 will start its first meeting of the season at 4101 White Plains Road in the Bronx, 104666, and the time is 7 p.m. So please do all that you can to be a part of the community board. Even if you just want to be a part of the community board, please see your local elected leaders to make sure that you can put in an application to be part of the community board. So I want to thank everyone who's part of their community boards throughout the entire city of New York. It's a tireless job. It's a volunteer job, but it's the way we give back to our communities each and every day. And it's also the way to stay involved. Secondly, we want to let you know about our children. The Bronx Youth Empowerment Program is kicking off the school year as well. They will be having their orientation day, recruiting students to come in from the ages of 11 to 18. It's going to happen this Friday at 3:30 to 5:30 at the Richard R. Green Middle School campus at 3710 Barnes Avenue. Again, that's 3710 Barnes Avenue, Bronx, New York, 10467. And last but not least, I want to give kudos and praise and thank you to a man who's done so much wonderful work in the education system for decades here in the city of New York, one of the founders of the Eagle Academy in the borough of the Bronx, and has done such wonderful work. I want to give a kudos and just wish him well in his next endeavors as New York City Chancellor David C. Banks has submitted in his documents today to say that he's going to transition out of the Department of New York City Public School, leading the New York City Public School, coming to a conclusion at the end of December of 2024. So God bless you, my brother. Stay strong, and may the Lord continue to watch and bless you over your next endeavors. Well, let's jump into what today is truly all about. It is about health care and you. Healthcare is one of the number one things that in the budget that matters to everyone across the United States of America. And as we always say, without your health, it doesn't matter how your wealth, because without your health care, nothing else matters. And that's what we're going to be talking about. We have a great dynamic guest that's in studio today. He's been part of the healthcare system for decades, over 25 years as an executive. I had the privilege of meeting him when he was at Health First, but he's been moving and grooving and shaking the healthcare world and is an expert on the things that are happening. So I'm so grateful and thankful to have him to be part of today's conversation, the Vice President and Special financial advisor to the CEO of Emblem Health. Welcome to King Talk Tuesday, Mr. Brother George Hills. How are you, good man?
Hey, what a pleasure to be here. Thank you so much for inviting me.
Well, I'm glad.
What a pleasure. Delighted to be here with you.
Well, I'm glad you're here. And we're waiting for our next guest, Cynthia Fisher, to chime in. And she's a big advocate of healthcare and making sure patients' rights are always managed and taken care of. So when she chimes in, we're going to bring her in and talk about and get her thoughts on the healthcare system. But Brother George, can I call you Brother George?
Yeah, most certainly.
Okay.
I'm flattered.
Brother George, talk to us a little about who George Holtz is, because you're about to drop a lot of information, but I want people to know who you are, the man.
Let me tell you, George Holtz is a man who is filled with nothing but gratitude. My wife, Ruth, and I, every morning when we wake up, we say the same prayer. Lord, you've given us more than we deserve, and our hearts today are filled with gratitude. And that's how I start every single day of my life. My father was born in Harlem, but he was raised in British Honduras, or Belize. And he came back to America when he was 16 and a half years old. And that was during the Civil Rights era. My parents came to New Jersey, where I lived all of my life, as a part of the Great Migration. And he would always say, son, I know you're upset about a lot of things that have happened in America and continue to happen in America, but it's still the greatest country in the world. And I've never lost track of that. And so who is George Holtz? George Holtz is a fella who the Lord has given more than I deserve, and I'm very grateful. And every day I try to make the world a better place. You know, one of my hobbies is visiting Black colleges. And when I go to our historical Black colleges, I talk to the ancestors. And I say to them, thank you for your sacrifice. I know with this great university, when it started, it was nothing here but a shack with no running water and no electricity. And I know the pain and suffering that you must have gone to, I can't imagine. And because of you, I have this great opportunity, I say to them. And I say to them, my only challenge in life is when I get to heaven and you say to me, George, what did you do with your freedom? I hope I won't disappoint you. So who is George Holtz? A man with a lot of gratitude, and a man delighted to be in healthcare, and a man delighted to all of you. Many of you I've had the pleasure of working with. I have the pleasure of working with you now as the vice president at Emblem Health. We have over 1,300,000 city workers who are part of Emblem Health. We have over 2.5 million members. And each and every one of you, I have nothing but gratitude for. So I look forward to our conversation about healthcare, because it is deep in my heart. And every day I wake up, I never feel like I'm going to work. Every day the Lord has given me another opportunity to engage you and talk to you about healthcare and try to make you healthier. And I know the healthcare is more than just clinical outcomes, especially us at Emblem Health. And one of the reasons why I am so honored to work at Emblem Health is because we feel that healthcare is more than just clinical outcomes and medication. You know, in healthcare, we say 80% of healthcare is really non-clinical. 80% of healthcare is your housing. Do you have secure housing? 80% of healthcare is your employment. Are you employed? Are you making enough money so you can be comfortable without a lot of stress? 80% of healthcare is education. Do your children have a chance? And do you have a chance to move up with a good education? Food insecurity. You know, I go to McDonald's all the time. And I always order the same thing. A senior coffee, 6 cream, no sugar.
Got you racing.
It runs between 84 cents and about 98 cents. And I look at people who are buying things that contribute to a bad diet. And I never do, but I want to say to them, you know, healthcare is like education. It really depends more on you than it does the system. as we know with education, if you want your child to do well in school, you've got to start reading to that child as an infant. And that child's got to get used to the cadence of reading. That child's got to see mommy or daddy looking at a newspaper, looking at a book. It doesn't matter what you're reading, but they've got to know that that's their security blanket, that book. And one of the reasons why almost half of the young boys in the 4th grade, Black and Latino minorities, Black and Latino primarily, by the 4th grade, they're either failing in math or failing in reading. And it's because good parents, responsible parents, dress their kids good, but just don't know how the educational system works. You've got to read to those children long before they go to kindergarten. You know, we say, well, the school system's responsible for my child's education. No. You are actually responsible for your children's education. That is so true. And the school system supplements you. And if you don't know that, you don't know that. It's no reflection on you. But I want to share that with you. And the same thing applies with healthcare. All right. You know, I want to remind people, we've got to watch our diet. When I walk into those fast food restaurants to get my coffee, and I see too many people not just buying in those restaurants, but too many people getting home deliveries. And I look and I said, home delivery French fries, they could have got a whole bag of potatoes. That's right. Could have got some lettuce. Could have got some string beans.
And a meal that'll last you for 3 days instead of one ship.
Instead of one day, you know, and much healthier. And I know it's an adjustment. You know, we all listen, anything you can fry or anything you put sugar on and salt on is going to taste good.
Put it on your finger, it tastes good. I'm supposed to eat it.
but you know, healthcare to a great extent depends on you. And so I want to remind you, you know, ask your doctor when you go to your doctor, and your doctor says to you, oh, I recently went to a doctor a couple weeks ago, I had an examination. Doctor said, Mr. Hulse, oh, you're such a great shape. And I said, oh, doctor, I'm flattered that I'm in great shape. I'm in great shape for a 79-year-old man.
God bless you. Don't look a day over 19 plus 12.
Well, I've been listening to my wife. But I said, how about if I was a 30-year-old man, 45-year-old man? Oh, no. Well, listen, tell me how I can be healthier. I want you to say to me, Mr. Hulse, how long do you want to live? Are you exercising? Now, you know, many of you who have seen me at my events know that I often talk about the 5-minute program to save your life. And I say, I'm going to give you the hardest challenge you've ever had in your life. I want you for the next 90 days to wake up every morning, and for 5 minutes, I want you to go against everything you've ever learned in church or the synagogue or the mosque or the temple or anything else. For 5 minutes, I want you to go against everything your parents has told you. For 5 minutes every morning for 90 days. This is going to be the toughest 5 minutes of your life. I want you to only think about you. And I want you to exercise. Okay. And I'm not concerned about the intensity. You can just move your legs in bed.
Not the intensity, move your arms, but the activity itself.
Yeah. Okay. Yeah. You can jog a minute, then do your neck a minute, do your arms a minute, do your leg a minute, or you can lay down and pull your legs up a little. 5 minutes. Andy, you hit it on the head. I'm not trying to change your actions. I'm trying to change your attitude.
And if we can change that attitude, we better. We got to take a quick break, and we're going to come back with you. And I see Cynthia has joined us, but we'll be right back on King Talk Tuesday after this break from Israel United in Christ.
Shalom Israel, Musa in Christ bless. Scan that QR code that you will see on the screen. Because guess what? We trying to push this truth toward the four corners of the earth. Let's push this truth toward the four corners of the earth, man. Stop playing games.
Make sure you subscribe to all our channels. We're pushing the truth.
Make sure you subscribe.
Make sure you subscribe. Make sure you subscribe. Make sure you subscribe. Stop playing games.
Well, welcome back to King Talk Tuesdays. I'm your host, Andy King, the show with real views, real news, and real talk. We're here every Tuesday live, 7 p.m. on Millennium TV News 24, as well as Facebook, Amazon Prime, Horizon Satellite, Apple TV, and so much more. We also air at 9 p.m. on Tuesdays on Optimal Channel 70, as well as Files Channel 2136. Tonight, we're talking about healthcare, and you just heard Israel United in Christ talking about health. And spirituality. And that's what it's all about, because there's so many components to making sure that you're healthy, but have the right to stay healthy, be healthy, and do healthy. I'm glad that we have Brother George Holst, who's here from Emblem Health, the vice president, and also the advisor to the CEO. But also we have Cynthia Fisher, the founder of Patient Rights Inc. across the United States of America. We're thankful to have her in. Good evening, Cynthia. How are you? Welcome to King Talk Tuesdays.
Thank you. Good evening, Andy. Thank you so much. It's an honor to be here and talk to you this evening.
Well, we've been talking to Brother Holst for a minute for the first break, and we just want to know a little about, our viewers want to know, who is Cynthia Fisher and what is the Patient Rights? What is that? Talk to us.
Yes, Andy. I am Cynthia Fisher, and I am founder and chairman of PatientRightsAdvocate.org. And we were formed around 8 years ago when 3 people came into my life that essentially had healthcare experience and had health coverage by insurance, and they had absolute financial ruin from the healthcare they were given. And every bill is a surprise in healthcare unless you know the price. So I philanthropically put together PatientRightsAdvocate.org to go to Washington and bring the voice of the voiceless to Washington to say people need to be empowered to be able to be in control of their health decisions and control their financial wealth decisions. And in any other market in the country, in the globe, you have prices, except in U.S. healthcare. And we know when we have prices, then we can have accountability and integrity in billing. So what do prices do for all of us? They allow us to lower our costs up front, and they allow us to be protected from overcharges. It's that simple. So that's what we do. And we fight for everyone in America to be able to lower their cost of healthcare and get access to care at prices they know they can afford. And
because you touched on something, because as an advocacy group, people try to understand, why is there a need for advocacy? Who has the connection to an advocacy group? Talk to us a little bit about how do you all do outreach to advocate for folks, and who are the folks that you're generally advocating for each and every day?
Well, essentially, we are advocating for all Americans, for every American patient and their families, as well as employers and unions. Because ultimately, it is the American worker who pays for all of healthcare. We pay for our premiums through insurance coverage. We pay with our take-home pay for any out-of-pocket costs, right? And then on top of it, we pay taxes. So we pay for Medicare and Medicaid as well for everybody to get healthcare. So if you think about who we advocate for for the consumers, and we see the consumers as all of us, and then employers and unions.
I love that, because unions sometimes, who are advocates for their members, who's advocating for the union member? You know what I'm saying? Because they're the ones out there on the fight all the time. So I thank you and applaud all the work that you are doing. But you mentioned something in regards to Medicaid. And I want to talk about Medicaid and Medicare, because I know that falls in your purview as well, of how your insurance company, and talks about how does your company actually work to service hospitals or just the everyday New Yorker?
Well, let's talk about how we service everyday New Yorkers and how we work with partners like we have here. Because we're a not-for-profit managed care plan. So we are not
hold on before you go. I need you to explain to people what managed care programs are.
You have my apology. We're a health insurance company. And of course, you see ads every day. Right now, ads mostly about Medicare. But those are all healthcare companies also. They are primarily what we call for-profit health insurance companies. And we are what we call a not-for-profit insurance company. So we have to, by law, spend 85% of all of our revenue on health care and or give back to the community. So we are, as our advocate talked about, we are the sort of company that goes out of our way to give back. We have 15 what we call neighborhood healthcare centers where people come into, and they come here for us to talk to them about housing and how they can get access to housing. We talk to them about SNAP or food stamps, how they might qualify. We talk to them about education. We talk to them about things that are non-clinical. And they're open to everyone, regardless of which health plan you belong to or if you don't have a health plan. Because at Emblem Health, we feel our responsibility goes beyond just clinical outcomes. And we feel that we're a model that we'd like to see duplicated around the country. We're a model. We want people to copy what we're doing. We want other insurance companies like ours, those you see on TV. We want them to also open up places where people can go for information about good health. Not connected to their insurance company. They don't have to be members of any health plan. They don't have to have any insurance. Now, you asked me about Medicaid and Medicare. We are one of 3 states, New York, Massachusetts, and Montana. We are 3 states that, in addition to Medicaid, we have another program for working people called the Essential Plan. There are only 3 states in the country that adopted the Essential Plan. And so this is for people, working people, who make more, who don't qualify for Medicaid. New York State has decided that we would give insurance to more working people so they don't have to pay for their insurance. Their insurance is free. Because we know, when we go into pharmacies, CVS, or any of the large pharmacies, when we go to Walmart, when we go to the gas station, when we go to the doctor's office, most of the people we come in contact with are not getting insurance through their company. And so in New York State, we provide that insurance for them free of charge. And so I want people to reach out to us if they're struggling, because you may qualify for health insurance. We know working people who we see at $1 or $1 or these sort of stores, we know they need health insurance. They're working often 2 and 3 jobs.
Which is
Home
sad.
Depot and all of these places, and insurance is available for them. So please reach out to insurance companies like ours and let us talk to you about the benefits that are available to you. Maybe you have 5 problems, but if I can take away the insurance problem, now you have 4 problems.
Which is usually the biggest headache.
Now you have substantially reduced the stress in your life.
So I want to go to Cynthia when he's talking about someone having to work 4 and 5 jobs. As a patient advocate, How do you talk to people about reducing that stress? And we know everyone has their own economic challenges, but is there a pathway that you have a conversation to move some of that stress? So as he mentioned, that some people are working 4 or 5 jobs. How do they stabilize themselves with your advocacy?
Yes. Well, let's be real. You know, in this country, 100 million people have medical debt, and most of those people do have some form of insurance coverage, and they're getting either denied access to care. Maybe they weren't authorized by the insurance company, or they're getting a balanced bill from the hospital, or they have a high deductible plan. And most people in this country, if they're getting a second job, that second job, maybe even 3, there's only 24 hours in a day, right. But in that family, a lot of times it's to pay for healthcare, and it's to pay for that coverage. And a lot of people that we're meeting can't afford the premium costs that exist today. So in all due respect, in our country, between the hospitals and the insurance companies and all the middle players, which many are owned by both the insurance carriers and the hospitals, there's lots of intermediaries between the point of care until we get our bills. And what we're finding in the United States, we pay nearly 2 to 2.5 times more than any other country for healthcare. And that's because hospitals and insurance companies have been working with hidden prices and hidden billing and payment information until way after you get it. And in any other functional market, it only functions when the true purchaser of that insurance policy and that true purchaser, who is the individual consumer and the employer and union, has access to the information. And so what we're finding, which is really exciting, Andy, is 3.5 years ago, by law, all of us have the right to have all hospital prices and insurance carrier prices compared. And guess what we found? We found that once we get to see all of these prices, we found that there's wide price variation for the same service in the same hospital. Let me give you an example in the Bronx.
Okay.
A hospital in the Bronx, for the same appendix procedure, same coding, one insurance plan paid $1,963. Let's just say it, $1,963 was the charge, all in, for that appendix. No complications. Another patient, same hospital, same day with a different insurance carrier plan, was $63,000.
Whoa.
Okay. We're talking about an over $60,000 price difference based upon your insurance plan. And on top of it, that's 32 times more. Can you imagine going in the Bronx and filling up your tank of gas, okay? And you pay $50 to fill up your tank of gas, and I pull in behind you, Andy. And if I use the math, say 30 times more, the same amount of gallons of gas in my car, I get billed $1,500. That's 30 times more. Can you imagine? You and I would both get out of our cars and go into that station manager, and I know you'd fight for me to get a fair price. That's what price transparency is doing. It's starting to discover that, yes, in all due respect, it is wonderful to have coverage. But if you don't know how much that insurance carrier negotiated for you and your plan, and it may be $60,000 more than the next patient in the same hospital, that's crazy money. Yeah,
that's for me, that's theft. That's just total theft, and it's negotiated. But we got to go to a break because time is moving fast. We are at halftime of King Talk Tuesdays, the show with real views and real dude talk. So we're going to be right back with our great guest, Cynthia Fisher, the founder of Patients' Rights Advocacy, and also the great vice president and special advisor to the CEO of Emblem Healthcare. Right back after this message from our good neighbors.
Good Neighbors Community Outreach Agency provides programs that help community residents improve their lives and support their families. Are you in need of food, clothing, employment, or a home? We also provide immigration services and passport renewal.
Hi, I'm Pastor Glad.
And I'm Lady D.
We're here to serve you.
Need help? Ask us.
You can reach us by calling 718-652-3288 or visit us at gncdcny.org.
Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV.
Welcome back to King Talk Tuesdays. I'm your host, Andy King, the show with real views, real news, and real talk. We air every Tuesday live on Millennial TV News 24, Facebook, as well as Roku TV, Amazon Prime, Apple TV, Horizon Satellite, and so much more. We also air at 9 p.m. on Tuesdays on Optimal Channel 70, as well as Fios Channel 2136. Again, if you have a thought, comment, or question, you can email us at kingtalktuesdays@gmail.com. Again, our email address is kingtalktuesdays@gmail.com. And you know what I always say? People pay attention to people who participate. So please tell everybody we're at halftime of King Talk Tuesday, but there's much more to discuss as we talk about healthcare and you. But one of the things that we always express during halftime of King Talk Tuesdays is just a little scenario of what the world has been going through. And we know from the last years of the pandemic that has been on the face of this earth, so many of our friends and neighbors and families have transitioned. And there's a lot going on that has hurt the world. The human component is the main culprit of it all. And I ask everyone, whatever you are going through, find a higher power to help you, guide you, navigate you, and give you the light that you need. I know for me, it's the Most High in Christ. And I know for him, you know, if I get in front of him, I will trip and fall. And concrete hurts. So I let him carry me through my ways, carry me through my trials and tribulations, because he did not say life was not promised. He didn't say he was going to have an easy life, but just told you you're going to go through some stuff in life. So I know today, I thank the Most High in Christ for everything he's provided for me through the joy, the laughter, the great times, the trials and tribulations. So I ask you all, when you find those moments of confusion and despair, and even happiness and sadness, offer up a prayer of thankfulness. Open up a prayer for your neighbors and your friends for being glad. Open up a prayer for protection. Open up a prayer for wisdom and guidance and love. Open up a prayer for yourself, your family, your neighborhood, your community, your friends, your frenemies. Just say a prayer. Prayer works. And trust me, when times get rough and tough and you get out of yourself and you let a higher power manage it, trust me, life is a whole lot smoother and calmer. So I say a prayer to all our viewers, a prayer for all our guests, and more importantly, prayer for a society that's in need of some spirituality and guidance that get us through the next days that are coming forward. But if you don't have, you can have all the wealth, but if you don't have your health, it doesn't matter at all. And that's what today's conversation is all about with the great Cynthia Fisher, who is the founder of Patients Rights Advocacy.org, and also our good brother George Holtz, who's the vice president and special advisor to the CEO of Emma Health, one of New York City's and New York State's most prominent healthcare systems that deliver for all. Now we have a variety of healthcare companies that provide services, and we have a number of advocates that do the work. But you touched on something, Cynthia, before we went to break, the imbalance of payment, of how people get paid. So I'm going to ask you, Brother George, talk to us a little bit. How do hospitals or nursing homes, how does that funding actually work? What's the formula? How do people get paid?
Well, actually, you know, the hospitals set the rates.
Okay.
We negotiate with the hospital for the best rates we can get, but the hospitals set the rate. As you know, before we were Emblem Health, which has been about a dozen years. Before that, we were two companies, HIP, HIP, and GHI. These companies, one was started by the city of New York to protect city employees. The other was started by the unions of the city of New York and the state of New York to protect their members. And so these two companies came together. And our mission has never changed over those 46 years. We are here to protect the people who work for the city of New York. We're here to protect those people who are union members. We are here to protect people who are in public health insurance, be it Child Health Plus, Medicaid, Essential Plan, what we call Obamacare, or Medicare. A small group, a large group. Our mission hasn't changed.
Right.
And so Cynthia, as well as many advocates, are touching on things that are of concern to all of us, because there has to be fairness. And I'm a big believer in advocate groups. As a matter of fact, Medicare Rights Association, which is really an advocacy group here in the New York area for people who have Medicare, I'll be at their dinner. I'm at their gala every year. I work all year with them as an advocacy group. And I've worked with many other advocacy groups, because we all have a responsibility to make sure that people have health care, they have that security. The Biden administration, it has done some things with the price of insulin. They're working on other things, but it's very difficult. It's difficult to bring down the price of insulin. And Sylvia talks about the different prices. You can go to Canada and find better prices on drugs, the same drugs. You can go to Western Europe and find better prices. So it most certainly is an issue. It's a concern to us. And we welcome those advocates who can help our members and the community, because we are a not-for-profit organization committed to wellness, education, and prevention. You know, doctors are often taught how to manage illness and disease, but we have added to that paradigm. We think we also have to work on education and prevention. Education and prevention also has to be an active part of healthcare. If you're over 30 years old, you should ask your doctor, am I pre-diabetic? Very often doctors will tell you you're diabetic, but they never told you you're pre-diabetic. And if you're pre-diabetic, then you know, doctor, what do I have to do? So instead of becoming a diabetic at 40, maybe I'll become a diabetic at 90. And he or she might say, well, here's some small changes you can make to your diet. Here's some more small changes you can make to your lifestyle.
So mentioning that, Cynthia, I want to bring you back into the conversation, because you're mentioning changing of lifestyles. We mentioned the cost of insulin. We mentioned the high prices. What's the advocacy part about encouraging human beings to do better by themselves physically with their own natural health care, that they don't need to get insulin, that they don't become pre-diabetic, to stay away from the healthcare system because they are doing the right things for themselves, so they don't need to go to hospitals. They don't have to, unless, you know, just a terrible illness or you break a foot, you know, you don't have a choice. But what kind of advocacy are we doing to help humans build the human condition better?
Yes, well, you know, you came on after the break with this, you know, beautiful, enlightened, you know, prayer and spiritual side. And part of it is following the light. And, you know, in the sunlight, where we can see what kind, you know, how do we take care of ourselves? Yes. And I agree with George and you that getting the, you know, preventing needing sick help, right? But being as healthy as you can up front. And that means being able to get the mammogram for women when they need it, to make sure that they, you know, prevent breast cancer, right? But what we're finding is that people fear going in to get those preventative care, because nearly everyone, Andy, has a story of being overcharged by healthcare. And people in their families have gotten $1,000 bills for something that they thought would just be, you know, under 100. Right. And so when you get these bills in pieces, months and sometimes even a year later than you got your care, and it didn't reflect what actually you got, Well, let me tell you what's happening. As long as hospitals and insurance carriers and all the middle players keep prices hidden, they can charge whatever they want. And you have to realize that unions in New York have seen coverage rates for premiums go up 24% in 1 year and 16% the next year. That's far higher than inflation because the wages aren't going up that much.
Correct.
Even food costs aren't going up that much. I mean, we're looking at premiums for healthcare, and a lot of people have a high deductible plan, right? And they stay away from getting care because they can't afford their deductible, right? If you're making $50,000 a year and you've got a $6,000 deductible plan, oh my goodness, you don't have $6,000 in the bank.
So true.
So what we're finding is now that we're having price transparency, and this was done by President Trump, and you have to realize President Trump appreciated the American worker, and the American Union wants price transparency. And how did he get it done? He used Obamacare because President Obama in the Affordable Care Act gave us the right to know all prices. And then it was sitting on the shelf collecting dust. And he dusted it off and he put it in as a rule. And then President Biden said, we need to make the fines higher. So we have to fine the hospitals higher because they're not complying with the law.
So let me ask you this. Now, you're saying that they're not complying with the law. So how do the American people learn more about what you're sharing and how they can be an advocate for themselves? Because what I'm hearing from you, there's a rule on the book, the price. Because I know for myself, I've been to the doctor and nobody ever told me what my cost was until I got that mail and like, Lord have mercy.
Exactly. So let me give you an example. This I love. So even with only 34% of the hospitals fully complying, because we do a report and we show all 6,000 hospitals in the country. So anybody in your listening audience can go to our website, patientrightsadvocate.org. And we have all 6,000 hospitals, their very own pricing files, and we convert it to like an Excel file. Look, it's not easy because they didn't make it easy. But we know tech developers that are trying to do mobile apps right now. So that anybody could like, where are they going to get an MRI? And what's the price? How much is a colonoscopy? How about strep test, right? These prices have codes. And if you get a bill, ask for all those codes itemized. And if you feel you've been overcharged, go to our website because we have a step-by-step process on how to get an itemized list, and don't pay that first bill until you make that hospital prove that that was your insured negotiated rate. And if it wasn't and they overcharged you, fight it, because remedy and recourse can happen and you're going to have to fight it. But we show you how online. We give you access to all the charges. And if your hospital's not complying, look at comparable ones in your geography and look at your insured plan, and you'll get to see what prices get negotiated. But let me also tell you something, Andy.
Yeah, we got to go to a quick break. But before we go to that break, I want you to give that website again that people can go to. Your website again that people can go to. patientrightsadvocate.org. patientrightsadvocate.org. And what I also want to share is sometimes the cash prices are significantly lower. And I'll give you an example. A union member who I saw limping, he's an HVAC, air conditioning, heating worker. I said, you need that knee taken care of. He said, well, I'm still paying $1,500 for an MRI I got that I can't afford. I said, you know what? Here's the name. If you want to go nearby, you can pay cash money, $250 all in, and you can get that MRI. And that's far lower than his portion that the hospital was going to charge. So do you want a $2,500 MRI from the hospital, or do you want to get it for $250 cash? And let me tell you, it is amazing because here in Boston, Mass General Hospital charges our plan, for my husband's plan, $7,500 for that MRI. But I know I can go pay $250 cash and save myself and our health plan. Wow. Well, we're going to come back and talk more, and we're going to jump into how this whole healthcare system affects families and our children directly. But we're going to take a break with a message from a youth program, the Bronx Youth Empowerment Program. We'll be right back on King Talk Tuesdays.
Thank you.
The Bronx Youth Empowerment Program, YEP, is a youth organization that has served the Northeast Bronx for 17 years. During our tenure, we have provided recreational and educational forums that have nurtured the growth of many youth in the community. YEP has also serviced hundreds of youngsters around New York City. YEP's target audience is youth from the age of 11 to 18 with the goal of helping youth become productive adults. YEP provides young people with resources to explore leadership skills, community involvement, and self-development. YEP consists of weekly and bi-weekly informational sessions with guest speakers from professional, political, and entertainment arenas. Also, as a part of community involvement, YEP will host trips to a variety of venues for educational and recreational experiences. As we continue to partner with other local organizations and serve our community, we will strive to unite and develop the youth in our community. The mission of the Bronx Youth Empowerment Program is building mind, body, and community.
We're back here for our last segment on King Talk Tuesdays, a great youth program, the Bronx Youth Empowerment Program, which we mentioned earlier. We'll be having the orientation day to kick off the 24-25 school year at Richard R. Green this Friday at 3:30 p.m. So if you have a child from the ages of 11 or 18, you want to be a part of a dynamic organization that's building mind, body, and community, the Bronx Youth Empowerment Program, BronxYEP@gmail.com. You can contact them at BronxYEP@gmail.com. Let's get into the last 15 minutes that we have. Let's literally have about 12 minutes going and running. But I heard the conversation about cost, price, hospitals, who's setting the prices. But I need to know, and I want to know, I'm going to go to you, George, and back to you, Cynthia. How do insurance companies, how do we make sure that they're in compliance with healthcare laws and regulations?
That's a very good question. So with respect to laws and regulations, insurance companies are very, very highly analyzed by the New York State Department of Health and by the federal government. So I think I don't think there are a lot of companies that are not in compliance. Mm-hmm. I think most companies are in compliance. I think the problem is that, perhaps the laws should be changed. What would you recommend then? Cynthia talks about something more transparency in your hospital bills.
Right.
And I'm totally in agreement. There should be more transparency in your hospital bills. There's also a push in our state and in Congress also for hospitals to show what they're charging for different procedures. Why should you go to one hospital? I think Cynthia touched on this, and maybe a procedure is $5,000, and maybe another hospital 10 blocks away, and the procedure might be $30,000. So there needs to be more transparency, and we're most certainly in favor of that. Andy, if I could just invite everyone who's in the Bronx or Northern Manhattan on Tuesday, October 1st, from 12 noon to 3 p.m., Emblem Health, we're going to have a community diabetes wellness program at 245 East Fordham Road. That's our neighborhood care office. It's near Kingsbridge. So where Kingsbridge runs into Fordham Road, I'm inviting everyone who is listening or watching our program on Tuesday, October 1st, to come by our Emblem Health neighborhood care facility. And this is one of the facilities that I talked about, where it is not here for clinical services. This is for services to help you with housing, services to help you with SNAP, health services to help you with employment, health services to help you with jobs, health services to help you with yoga. And we encourage you to come by there. But this Tuesday, October 1st, from 12 noon to 3 p.m. here in the borough of the Bronx at our Community Diabetes Wellness Program, 245 East Fordham Road near Kingsbridge. There's going to be A1C screening, and you should know your A1C screening numbers. There's going to be diabetes education sessions. There are going to be gift cards giveaways. And so I'm encouraging all of our family members, all of our friends, if you're insured or you're not insured, regardless of what insurance company you may have, all are welcome.
Good.
Please come and join us.
Please make sure you make your way there. And I'm happy you mentioned that again before we close out. Cynthia, you still with us, right?
I'm still with you.
Okay. So we talked about this imbalance of pricing. How do we have the marketplace for pricing that everyone knows? Because everyone, for instance, you can go into any bodega or delicatessen and a bag of chips is 50 cents. You know what I'm saying? Across the board, no matter where you go, you can get that same bag for 50 cents. How do we put something in place that it's not so hidden in the healthcare world that the same appendectomy is the same for regardless what health insurance you have or where you have in this procedure? How do we establish something like that?
Well, the very way we establish that is to first start with prices, Andy, because when we see prices and we see this wide price variation, none of us is going to tolerate being hosed, being overcharged, right?
Right.
And being crushed by those overcharges when we know it's not a fair price, right? That 50-cent piece bag of chips shouldn't be $500 to another person. And that's experiencing in healthcare, right? It's crazy money. When we see even childbirth, look at that. What's it cost to have a baby? We see some women going in and having a baby, and some it's $5,000 all in, and others are nearly $100,000 for an uncomplicated birth. Like, and you can see these price variations in New York City. But let me tell you, if we start with prices, all of us know how to be consumers. Every one of us knows how to be a consumer. And the reality is people just want to know, what are we going to get and what's it going to cost? So price discovery will usher in transparency and quality too. What are you going to get for that price, right? And then outcome. What can I expect from that knee replacement? And guess what? When we all start to be able to be empowered to shop, all of us want the best quality at the best price. But the reason why people are suffering is because nearly everyone has a story of being overcharged. So what the hospital and the insurance industry and all the players that are involved with them need to understand is that it doesn't hurt to do the right thing. And the right thing is by law to show very easily to everybody and freely. So I should get prices for free, right? I shouldn't have to pay for prices.
So true.
Right. Yeah. But right now, you know, the insurance industry is complying with the law. However, they've dumped so much data into a pile that only a very sophisticated tech firm that needs to charge $100,000 to go see the prices can see them. So most unions and employers can't even afford to pay those tech guys to see what the insurance prices are.
Well, that sounds to me like, again, in a world of oppression, discrimination.
It is.
Because it's a big discrimination. It's information discrimination. It's information overload, which is discriminatory towards the everyday person, but more important to anybody who has access to these systems to learn the information. So I won't be running out of time here, but I want you to.
Right. Can I just say that we've got price discrimination and we've got discrimination of being well informed. But you know as well as I know, Andy, when we are well informed, it gives us power. It gives us power to be in control of our family budget. It gives us power to be in control to get that A1C test at a price we know we can afford and take care of our insulin and get in access to insulin. And the good news is, Andy, is it's working. Let me give you an example. I met you at the SEIU 32BJ meeting, right? Yes. The union, the real estate union workers, this was amazing. They reversed engineered the prices years ago and they looked at their health plan. They saved $35 million because they took New York Presbyterian out of their health plan because they were way overcharging. And what did they do in the first year for 200,000 people? They saved $35 million. After 3 years, it was $100 million. They gave the biggest raise in history to everyone, and they gave a $3,000 bonus to everyone.
That's a model that everyone should be looking to follow, to bring down the cost, but people being ripped off, because that's all it is. People being ripped off. Overcharging is a rip off. That's all it is. And we call it for what it is on King Talk Tuesday. But we literally have about 3 minutes left, and I want to give each one of you a closing statement to share what you want to share. But I did have I want to thank Latoya Reed, who sent in that last question. But this question comes in from Neva Schilling for King. She wanted to know, how do missed appointments by patients impact the healthcare system? Quickly, can you give us an answer on that one?
Missed appointments affects everyone, because very often doctors or clinicians are waiting and there's no one there. And so if you're not going to be there on time, call in ahead of time. Let us put somebody else into your spot. Or if you know the day before you're not going to be there, call so they can move someone up. So that's a big part of the cost. Mm-hmm. It's not a big part of the cost, but it is a part of the cost. Mm-hmm.
Okay. Well, with that being said, Cynthia, I want to give you an opportunity to take 45 seconds. What closing words? And we're going to have to do this again because it's just too much information to cover in an hour.
It can take 30 seconds. I'd like to make one more announcement.
Okay.
Cynthia.
Go for it, Cynthia. Final words to our viewers about healthcare and you.
We welcome all of your viewers to go to patientrightsadvocate.org. And if you feel you've been overcharged by a medical bill, come to us and we'll help you look at those line items and get access to be able to save your own money. But more importantly, go up front and you demand the prices because it's your right. And when you sign in with that electric pen, don't sign in with your life away, because you're signing in that you are signing a blank check. They can charge you whatever you want. So if you get that price up front, lock it in. And when you sign your name, say that you will not pay anything more than what that price is that they agreed and you agreed, because it's your money and you have the right and the power to not be overcharged. And if you take a picture with your phone, when you sign that in, that's your legal document. It's your money. It's your right. You have the right to know all prices and keep fighting to lower your costs and protect your family.
You just heard it best from Cynthia Fisher, the Fisher of, not just Fisher of men and women, but Fishers of healthcare. Go ahead.
I'd like to just say, come to our neighborhood care facility at 245 East Fordham Road, where Kingsbridge comes into Fordham, on Tuesday, October 1st, from 12 noon to 3 o'clock. We're going to have A1C screenings. We're going to have diabetes education, gift cards giveaway, and a lot of other things. Please come by. In addition to that, I want to talk about one thing Cynthia mentioned. Very often, people who are making $40,000 or $50,000, depending on how many children you have in New York State, you may qualify for no-cost health insurance. So around the country, you would be paying for this in the other 47 states. But New York is one of 3 states in the nation that has a plan that exceeds Medicaid in terms of who qualifies for no-cost health insurance. Please come by and let us help you get no-cost health insurance. And a lot of the problems that Cynthia is talking about, and I applaud her, we can eliminate from your life.
I thank both of you. We're running out of time here. Both of you have been, we're going to do it again. But on King Talk Tuesdays, we end every show with the scripture. And tonight's scripture reads from Luke 6:38. Give, and it shall be given unto you. Good measure, pressed down and shaken together, and runneth over, shall men give unto your bosom. For with the same measure that you yet meet, with all it shall be measured to you again. If no one told you today, God loves you, and so do I. Your friend and your neighbor, Andy King. Peace.